Good afternoon. Let's try again. Good afternoon. All right, everybody's wearing low, I know, but I hope that you've had some yummy snacks and dips and are feeling a little energized for our very last session. I value and am honored that all of our speakers could join us, but we might have saved the best for last today. It is truly my pleasure to introduce our next speaker, and he is truly one of my favorite people to learn from. Dr. Haller is a professor of pediatrics at St. Louis University School of Medicine and SSM Cardinal Glennon Children's Medical Center. He is a past president of the Missouri chapter of the American Academy of Pediatrics and has served on the board of the Missouri Foundation for Health. He also serves on the Arts and Education Council for Greater St. Louis, where he helped to create the new Arts and Healing Initiative to fund arts and medical organizations that utilize the arts to promote health and healing. He is a writer, an actor, a cabaret artist who has performed in cities as famous as New York, San Francisco, Denver, and my favorite, Chicago. He has also twice been named Best St. Louis Cabaret Artist by the St. Louis Post-Dispatch. He appears regularly in local and national media to advocate for child health, LGBTQ health issues, and the arts. And his special interests include expanding health care for marginalized communities, ameliorating toxic stress in children, and educating the medical community and the general public about cultural competency, health literacy, vaccine hesitancy, the relationship of medicine and the arts, the effects of media on children, and the special health needs of LGBTQ youth. As a primary care pediatrician for over 40 years, he has dealt frequently with parents who have expressed concerns about vaccinations for their children. In that time, Dr. Haller has developed techniques based on the skills of improvisational theater and motivational interviewing that help parents recognize their fears and allow them to move toward making appropriate healthcare decisions for their children. Please join me in giving a warm welcome to Dr. Ken Haller.
Oh, there it is, right there, okay.
Yep.
Hello, hello. Okay, great, got the clicker. Okay, we got everything. Good afternoon, everybody. I'm the only thing standing between you and dinner. Believe me, I recognize that. So I will try to be expeditious about my presentation while still getting everything in. The goal is effective scripting, moving the needle for vaccine-hesitant parents. Get it? Moving the needle? Okay. All right. So, no relevant financial relationships, unfortunately. So what do we want to do? We want to gauge the emotional setting where parents, and patients, for that matter, are making decisions about vaccination, find common ground for parents to form trust relationships, and create an effective scripting to present factual information to help parents make healthy decisions about vaccinations. So, when a vaccine-hesitant parent comes in, what do we really want to say? Now, the thing is, like I said, as Nicole said, I'm an actor, and I know the difference between being on stage and backstage, including when I will get feedback. So, when we talk about, when we are in a professional place, we are on stage. Now, on stage does not mean being fake. It means being completely yourself in the role that you're inhabiting at that moment. I'm often in the role of physician. Right now, I'm in the role of teacher. You're in the role of student. When we leave here, we will be in other roles, maybe a spouse, a parent, an adult child, a cabaret performer, who knows? But we know those roles intuitively. So even though I am labeled an actor, we all know what acting is. And I bring that up because when we are with our patients, we are on stage. But we also have those moments where we're backstage. Anyone here actually done acting on a stage? Yeah, so backstage is crazy, right? Backstage is where you curse and you throw things and you go a little crazy, and then you go on stage and go, hi. Like that. So backstage, when a vaccine-hesitant parent comes in, what do we really want to say? Well, I'm a Trekkie, so I say, that is highly illogical. But I'd say, what would you really want to say that you'd never actually say to a parent?
That's stupid.
That's stupid, yes. What would you say? Oh, Lord. Okay. Well, that's a start. What else?
Help me think of something.
Be as nasty as you want.
Why would you listen to them or that dumb thing?
Yeah. You got anything?
Are you kidding me?
Yeah. Actually, that's pretty good. So, are you kidding me? It's right up there. Yes, okay. Are you saying I want to poison your child? Do you think I'm an idiot? Why are you being an idiot? Jenny McCarthy is full of crap. If you really loved your child, you'd get them vaccinated. I care about your child. Why don't you? Now, the problem is, I've actually heard pediatricians say all of these things. Do you think they work? No. Okay, good. So we already know something about communications. These do not work. Now, the thing is, it's okay to feel these things. It's okay to even think these things and put them in a little thought balloon and then push them away and then come up with better messaging. So, here's a cartoon from the New Yorker. It says, if you connect the dots, it spells out my parents are idiots. Yeah, that's something I'd feel like saying. So I think it's important for us to understand a little bit about the culture of our professions, what it means to be a health professional. Our professions are hierarchical. Within our professions, there are hierarchies. Between our professions, there are hierarchies. And between us and the general public, there's a hierarchy. And the thing is, as we heard in the last presentation, which was excellent and wonderful, we generally tend to be trusted and believed, which is really good. Now, what do we do with that? Well, the way we communicate it is maybe the problem. The thing is, within our profession, we have faith in reproducible evidence. So we see these studies, we get these data sets, we get p-values and chi-squares and all those kind of things, and we see what makes sense, what's real in a health setting. Now, when a student comes to me and gives me an assessment plan on a patient, but they miss something big, I'll say, no, that's wrong. Here's what you need to notice, and here's what you need to do. And the student will go, okay, fine. But if I say that to a patient, no, you're wrong, what you need to do is this, they'll pick up their kid and walk out. That's called a no but response. No, that's wrong, but what you need to know is this. Within our profession, that makes sense because we're transmitting information in a way that is not emotional. But the healthcare setting is always emotional. There's always an emotional component. And if we say things like, no, you're wrong, but we need to know is this, people feel stupid, they feel patronized, they feel dissed, and they feel like we have shut off communication. So, we are also geared toward problem solving. So when people come in and say, I've heard this about vaccines, we think that this is a problem to be solved, rather than we think that this is a factual statement this person is making, when in reality, it's more likely a largely emotional statement. Unfortunately, don't get me started on EHRs, but I'm going to talk about them. They're a mixed blessing, obviously, and one of the things about them is that there are so many little buttons you can push that a patient visit can turn into an interrogation rather than a conversation, because I have to push a button for all of these things in the algorithm. And so I ask a question, I get an answer. I ask another question, I get an answer. I get another question, I give an answer. And the message I give patients is the only information I'm interested in is the answers to these questions. If the patient or the parent is thinking, I have something I want to ask, but I don't know where to put it, they won't ask it. Finally, everyone here, I hope we have a pretty good self-image. We do good work. We do important work. And the thing is, that is reinforced externally and internally. We have spent our lives doing this. We've spent our careers doing this. We've given up a lot of time with family and friends to do what we do. And that's important. And so when people say, I don't want to do this thing that you recommend, it's hard for us not to take that emotionally. So let's just take a look at vaccines a bit. This is the 2024 schedule. Lana, I made sure I got the 2024 just for you. That's a lot of stuff. There's a lot of stuff there. If you don't know anything about healthcare or science, you might go, what the hell do they want to do to my kid? This was the vaccine schedule in 1955, and this was a big deal because they just added polio the year before that. Other than that, it's DPT and smallpox. This is 1972. Now we've got MMR. This is 1995. We've added Hib and switched to oral polio vaccine. This was all kind of manageable. But now we got this. And so if people are a little intimidated by that, I don't blame them. It looks like a lot of stuff. So what questions do people ask? These are some of the FAQs that I get. And the thing is, when I answer questions about this, I don't immediately go to a scientific explanation. I try to go to a metaphorical explanation, some everyday kind of thing about it. So why do kids get these vaccines? Well, these are things that are common in the population. They cause terrible disease in kids, and researchers have developed vaccines for them. So like pneumococcus, bad disease, common in kids, got a vaccine. Same with rotavirus. Anthrax, bad disease, not common in kids. We got a vaccine, but I've never given an anthrax vaccine. And RSV, now we have a vaccine. So, and I'll come back to that. I'll come back to that in a minute. So why the scheduling and spacing? It's based on how they were, how they were tested and approved. Fits the need to get kids immunized as early and safely as possible because these things are really bad the younger you are. And that state and local jurisdictions decide, all these things. Now, again, as Lana said, I don't get into required versus recommended. I say these vaccines are what your child should get today. So how do vaccines work? This is where I get into a little bit of storytelling. I'll say, all right, thing we want to vaccinate against, say a rotavirus. It's like a small beach ball, which would be scary, right? But what scientists or people who are smarter than me have done, have taken little bits of it that are not like something that's part of me, and they have created a vaccine so that when that gets into someone's body, the immune system's going to go, wait a minute, that's not me, that's something else, that's a bad thing. The immune system is kind of like the cop on the beat, wandering around and saying, that's Kenny. That's Kenny. I'm Kenny, by the way. That's Kenny. That's Kenny. Wait a minute, that's not Kenny. We're taking you into the station house. And that's when it goes to the bone marrow or a lymph node, and we get all kinds of immunity to it, and a wanted poster gets up. So when this shows up again, anything attached to it is going to be attacked by the immune system. And I found that people kind of go, oh, that makes sense. I can see that. So isn't this too much at once? Well, and here's where one of the things I think is very important. I never say no. I don't start out by saying no. Isn't this too much at once? I'll say, yeah, it does seem like a lot, doesn't it? There are a lot of things we can protect your child against, which I think is great. The thing is that your child's immune system is already dealing with thousands of different microorganisms. From the time your child was born, their body was being exposed to viruses and bacteria and funguses. And right now, sitting on your lap, your child's immune system is negotiating with all of this, figuring out what's friendly, what's helpful, what's not, what's just sort of there. And so these vaccines we give, that's a drop in the bucket. That's nothing. But what it does is it gives your child an early warning in case these bad things show up, because if they do show up, it can take about a week for the body's immune system to respond to them. And a lot of bad stuff can happen in that time. This way, your child's immune system is ready right away. And the younger the child is, obviously, the worse it is. So if they say, isn't it, I do have kids who are delayed in their vaccines, and I have to give a whole bunch of jabs the same day. I'll say, yeah, it does seem like a lot. I get it, and it's no fun. But there have been studies that look at the child's pain response to one jab versus 3 or 4, and it's really about the same. So why spread it out and do it a whole bunch of times? Let's just get it all over at once. Then your child is done and you're done. And that has actually worked. The important thing with all of this is always start with some version of, that's a great question. I've heard that too, and I've heard everything. Even if I haven't heard exactly what someone has said, what exactly they're claiming, I've heard some version of it. So yeah, I've heard that too, and that is really scary. So I can see how much you love your child. Thank you for bringing this up. Now tell me exactly what you've heard. This is important too, because I could launch into a whole bunch of stuff. This story, Johnny comes in from playing with his friends outside. He goes, Daddy, where'd I come from? He goes, oh. He's 5 years old. I got to explain all this to him. So he sits him down, the birds and the bees and mom and dad falling in love and blah, blah, blah. The kid's like, okay. He goes, does that answer your question? He goes, I was playing with Tommy. He said he's from Cleveland. I want to know where I came from. So always ask, what exactly have you heard? And then I can say more specifically, yeah, I've heard that too. And here's the interesting thing. May I share some information with you? This is where you can say, this is what I know. And this is why I think this is important for your child. Oh, okay. And then ending with, I know you want only the best for your child. You love your child. I want the same thing. I just want to make sure your child is protected from bad disease, and I know you want that too. It's hard for people to disagree with that. So why do some parents still refuse vaccines? Well, vaccine hesitancy, we talked about in the last session. The World Health Organization defines it this way. I think one of the things we need to pay attention to is the 3 C's at the end: complacency, convenience, and confidence. Sometimes we spend our time talking about confidence in vaccines, when in some instances it's complacency. One of the things about vaccines is they've been so successful at making these diseases uncommon that people don't see them. I mean, I had measles, I had mumps, I had chickenpox, I had them all. But people haven't seen these. They don't know how bad they are. So there's that. There's also convenience. If someone has to take off from work and they're working 2 jobs and they may not have a car, this was talked about a little bit in the video, getting people to the place where they can get their vaccines, taking advantage of when they may be there for an acute visit is really important. So it's not just confidence, it's these other things too. So the thing is, when you come right down to it, about 20% of parents will express some hesitation about vaccination, but about half of those will agree to it if you make a strong recommendation in the office, if you are already a trusted healthcare provider for that family. When you come right down to it, probably only about 3% are people who will say, absolutely never, I'm not going to do that. So I think that's an important thing. Okay, this guy. I want to come up with I'm really bad at PowerPoint. I wanted to figure out how to put devil horns on it, but I couldn't do it. Anyway, this is the guy. And we think of vaccine hesitancy as just being caused by Andrew Wakefield in his paper in 1998 in The Lancet. And that certainly was an inflection point. It took it to another place. But vaccine hesitancy has been around as long as there have been vaccines. This book, The Panic Virus by Seth Mnookin, it's written about a decade ago, but it's still really good. It looks at the anti-vaccine movement. And he talks about how static the make-up rhetoric and tactics of vaccine opponents have been for over 150 years. Anxiety about the individual's fate in industrialized societies, knee-jerk populism, an imaginary elite with an insatiable hunger for control. Yeah, pediatricians are like that. Subjective beliefs over objective proofs, personal experience rather than scientific rigor. Any of this sound familiar? I mean, people get into their Reddit rabbit holes, and they are looking for evidence to confirm their bias on this stuff, and they can find it. But that's because they're only listening to people in a small group, and that's just gotten worse over the years. So vaccination, again, has been around for a really long time. By the way, the word vaccine comes from vaccinus, which is Latin meaning of or from cows. There you go, in case that comes up in a trivia contest some night. So of course, Edward Jenner was the one who noticed that milkmaids in communities where there was a smallpox outbreak generally didn't get sick because they had cowpox. He created the vaccine. But even back then, this was an anti-vaccine cartoon from 1802 called The Cowpox, or The Wonderful Effects of the New Inoculation. And it's hard to see, but if you look from left to right, there's a guy in the far left, your far left, yes, okay, who's getting a potion. As you go from left to right, people have like little cows growing out of their cheek and out of their nose and out of their butt. One woman has horns growing out of her head. So people were scared about this, have been scared about this for a long time. And frankly, the idea of putting something in your body that in another form might kill you is a little skeezy, so I can kind of understand it. This is from a pamphlet called Health in Pictures from 1930, smallpox. And the people on this, in this cartoon are the anti-vaccinationist, the faddist, Mr. Careless, and Mr. Anti-Everything, and they're all falling off the cliff of misinformation into smallpox. So this is not a new thing. This has always been there. Now, beyond vaccines, this was talked about a little bit in the previous talks about how there are differences among different socioeconomic and racial and ethnic groups, and certainly there are reasons why people, particularly African Americans, might be wary about a government health program. The most notorious reason, of course, is the Tuskegee syphilis experiments. In 1932, the U.S. Public Health Service went to Tuskegee, Alabama, to look at the natural history of syphilis, which was then an incurable illness. These men were offered free health care for the rest of their lives, but in the 1940s, when penicillin was discovered, which would have cured them or at least arrested the further progression of their illness, they weren't told about it. And some of these men were in this experiment until 1972. And as one mother said, Tuskegee always sticks in my mind. They don't really know what's happening. And here these people were guinea pigs, and I just don't want my children to be part of that. So there are a lot of reasons why people might have hesitancy about vaccinations. But still, with science on our side, why doesn't everyone believe us? Well, people can be pretty poor at risk assessment. There's creation of anti-vaccine martyrs. Anti-vaccine advocates, they are really good at messaging, and we often are not. So, poor risk assessment. As I talked earlier, people tend to believe people like themselves. They go to the same Facebook groups, they follow the same blogs, that stuff. As I said earlier, no experience of vaccine risk. Magical thinking. I own a 120-year-old house, and when I hear a funny noise, I just keep thinking, maybe it'll just go away. Maybe I don't have to look and see if something's fallen off the roof, but, So the adrenaline response is just not fight or flight, it's freeze. Anyone who's seen a squirrel knows that. So people who are in this bind sometimes think, I don't want to think about it. I'm not going to get my kids vaccinated because I don't want to think about it. There's also complicity with a potentially dangerous act. So the thing is, you may have heard all these things about these diseases are really, really bad, but I've never seen them. But on the other hand, I read these things about what vaccines can do. And if I don't get my kid vaccinated and she gets sick, well, there are medicines for that, and it just happened. But if I give my kid a vaccine and she gets sick from that, then I caused that. And I can't live with myself. So that, I think, is part of the calculus that people make in all of this. There's also been a long day. Confusing association with causality. So these are some things from anti-vax groups that look at increases in rates of autism and like when on the left, when MMR was introduced, and here different, various antigens that are in vaccines and things like that. But on the other hand, rates of autism have gone up with organic food sales. So maybe autism is caused by Whole Foods. Who knows? So the thing is, you can make any kind of association that doesn't imply causality, or it shouldn't. Now, there's also creation of anti-vaccine martyrs. Andrew Wakefield, the devil incarnate. By the way, if you want to read more about him, there's a guy named Brian Deer, D-E-E-R. You go to briandeer.com. He has done extensive research into the falsehoods that Andrew Wakefield has perpetrated, and it was largely his work that caused Andrew Wakefield to be disbarred and to have his license to practice medicine taken away. But that's actually made him a hero to some people. That he will give up everything for what he believes. J.B. Handley, which is a great name, kind of like P.T. Barnum, co-founder of Generation Rescue, which is Jenny McCarthy's group, was quoted in the New York Times as saying, "To our community, Andrew Wakefield is Nelson Mandela and Jesus Christ rolled up into one. He's a symbol of how all of us feel." Why not just throw in Mother Teresa while you're at it? So they do have compassionate messages. Wakefield says, what happens to me doesn't matter. What happens to these children does matter. Jenny McCarthy has said things like, in profound solidarity with families still struggling, I spoke up. We have options too often unspoken. I'm there at 3 a.m. and 3 p.m. celebrating victories and all that stuff. And it's great. Now, what do we say? Now, I know we're giving out some books by Paul Offit, and I think Paul Offit is wonderful. I've met him, and he's a great guy. And he is very, very passionate about vaccination. The only thing I'll say about him is sometimes he says stuff that should be said off stage. He says it on stage. And this is a quote from his book called Deadly Choices, How the Vaccine Movement Threatens Us All. Well, there's that. In the book, he says, there's a war going on out there. On one side are parents. On the other side are doctors. Caught in the middle are children. Really? I don't want to be looked at as an antagonist to parents. I don't think that helps us. Now I'm going to show you absolutely, positively, the worst quote I've ever seen from a doctor about vaccination, okay? Buckle up. This was from January of 2011 during the 2010-2011 H1N1 flu pandemic. It was in the Ladue News, which is a free weekly paper in St. Louis. And the question was, the H1N1 flu vaccine had not been included in that year's multivalent vaccine because nobody knew it was happening, but then it did show up. So they went, okay, H1N1 flu, took that off the shelf, made more of it. The vaccine had been around for a long time. But the question was, this is coming out separately, it's coming out late, is this a new vaccine? Again, have we heard that lately? Is this a new vaccine? And so I was interviewed about it, and I said, actually, it's been around a while. It's just that this is the way this played out. It looks like it's going to be really bad, so getting vaccinated as quickly as possible is the best option for you and your children. This is what this other guy said. I tell parents that there is absolutely no data to support a vaccine-autism link, which, okay, it's a fact-based statement, and failure to vaccinate children is foolish and dangerous. Then he goes on. Immunization is safe and effective with minimal minor side effects, which is fine. There's a small but real chance of complications, including fatal complications. With both the chickenpox vaccine, which he had not been asked about, which can lead to pneumonia, encephalitis, and hepatitis, and the influenza vaccine, which can develop into pneumonia or other secondary bacterial infections. This is someone trying to convince people to vaccinate their kids. Do you think it worked? So why did this guy say this stuff? Any thoughts on that? Well, I think he's probably exhausted, like a lot of us. He's talked to too many people who don't want to vaccinate their kids, and he's thrown all the science out there they can, even science that's irrelevant and not helpful. But when it comes right down to it is this: we are smart people. We believe in science. We are caring people. We do this to help people. And when vaccine hesitancy and vaccine denial threatens us at our core, it's a struggle to remember it's not about us. So one of the things I think that we need to appreciate is that we have to deal with patients' amygdalas and parents' amygdalas. Those are firing like crazy when they hear these things about vaccines. But I have an amygdala too. And when someone says this stuff, it makes me feel really bad. It makes me feel threatened, and I have to remember this is not about me. I just happen to be the person they're bringing this up with. And I have to be the adult in the room. As was said earlier, sometimes being a doctor is like being a mom or a dad. Sometimes I have to be the adult in the room, and I have to say, I hear you. I know that's really scary. May I share some stuff with you? So that's why I think we can get upset about this stuff. So what can we do? Well, these are the skills of master physicians. This is a paper written about 15 years ago. These guys surveyed about 50 people in Nashville. They're at Vanderbilt. And they found that these are the things they all do well, and they all do that are kind of unique. They do the little things. They pay attention to detail. They take time and listen. They're open to whatever's going on. They find somebody to like or to love about the person across from them. They remove barriers to care. They let the patient explain before jumping in with their own thoughts on it. They share authority for what happens next, and they are committed and trustworthy, letting people know, I will be here, and I will be here for you, or I will tell you who will be here no matter what. Now, what's interesting about this, there's nothing on that list about medical knowledge or procedural skill. Those things are important, but those things should be taken for granted. These are the things that make a healthcare provider not just competent, not just licensable, but this is what makes healthcare providers extraordinary and outstanding. So what we need to do is create trust. Assume parents love their kids. Don't ever, ever, ever use the dependent clause, if you love your child. Don't ever put if in front of that. Start with, I know you love your child. Recognize that parents have a very different knowledge base than we do. They haven't gone to medical school, they haven't gone to nursing school, they haven't gone to public health school. They don't know the things we know. And again, I'm really glad we had the previous session because so many of the things here follow from that. I mean, one of the people in that, I remember a patient saying something about, I wish they would dumb it down, and I hate that phrase. But the fact that someone would say that says something about what they consider healthcare providers to be. We shouldn't dumb it down for anybody. We should be able to translate it into standard English. When I was, my mother has gone on to her heavenly reward, but before she did, she would often call me with questions about her health, having seen her doctor, and deciding to call me the pediatrician. Has anything like that happened to you? Yeah, I'm sure. Why do people call us instead of their own doctor or their own nurse practitioner? They know us as people. They know us as someone they can trust. And sometimes with doctors, with nurse practitioners, with physician assistants, those of us who are primary care people, we may give them the feeling that I only am interested in these things. Don't ask me anything beyond that. So the thing is, my mom would call me and I would explain things in everyday language. But every once in a while, I would use a medical term and not explain it. And she'd go, now, Kenny, I know you're a doctor and I know you're smart, but I'm your mother. Explain it to me. Okay. So I think of that as the my mom test. How would I explain it to my mom? How would you explain it to someone you love who is not in this profession in a way that they can understand and a way that they could trust? So I think it's really important to realize that statements that sound factual are really emotional. People are coming from an emotional place. So we have to honor and value those emotions. We have to ask parents about the basis for their fears. Acknowledge that parental fear is real and even healthy. So the thing is, the facts, the so-called facts that this fear may be based on may be completely bogus, but the fear is real and the fear is valid. This is where we can finally get to the point where we help patients acknowledge the appropriate target for their fear, which is the disease, not the vaccine, and finally provide a fertile ground in which trust can grow. So this is where we get to the yes and improvisational theater. This is the cornerstone of it. Actually, what Lana expressed the other cornerstone of improvisational theater, which is listening to understand rather than listening to respond. Now, those of us who've been in medicine a long time, or in healthcare a long time, I mean, I'm going on 45 years now. I know I look pretty good. But the thing is, I can pretty much look in Epic and look at a chief complaint and look at a chart real quick, see why a person's there. I know exactly what they need. I know exactly what the assessment is. I know exactly what the plan should be. And I could walk in there and say, what are you here for? And here, I'd be like Charlie Brown's teacher. I could go, yeah, okay, that's right. Here's what's going on. Here's your prescription, and walk out. But what happens is when they're going, wow, they may tell me stuff that I had no clue that they were going to bring up. And I go, oh, that's interesting. So listening to understand is actually listening, actively listening to what someone says, and then responding to that, and maybe letting go of the preconceptions on it. So that and yes and are the hallmarks of improvisational theater. And who are these people? Whose line is it anyway? Okay, who's seen an episode of Whose Line Is It Anyway? Oh, go out, if you haven't, go out and watch one. There are about like 900 episodes of it. But basically, this is what motivational interviewing is. It is saying yes and to the person across from you. In improvisational theater, people are given a situation. Someone starts the improv, and then the other person or the other persons say, I see what you're doing, and here's what I add to it. And the first person goes, and I see what you're doing, and I add to that. And you go back and forth. And the thing is, patients and parents, I found, almost all the time, they don't know they're doing it, but they want that kind of response. And they will give that kind of response if we allow that to happen. So it's the most important rule in improv. I really think that this is the basis for Carl Rogers' unconditional positive regard, which he talks about in his work in the 1950s, finding somebody to like or to love about the person across from you. Again, listening to understand versus listening to reply, and knowing the difference between on stage and backstage. So what are our roles in our scripts? As we've talked about a lot today, but education is about repetition, so I'll say it again. People respect us. We can use that. Being aware of our tone of voice, our body language, being on the same physical level as people as much as possible, sitting down when you're in the room with them rather than towering over them. All this stuff is really important. Avoid contractions, avoid contradiction and the conjunction but. That's wrong, but what you need to know is, or I care about your kid if you loved your kid. We don't want to do that stuff. That is called the no but response. No, you're wrong, but this is what you should know. Within our professions, that makes sense to transmit factual information, but in the patient care setting, it does not. So we want to agree and use the conjunction and. I hear the fear in your voice. I see you love your child. May I offer some other information for you? I want the same thing that you do. So everyone in the office has to be on the same page. Again, we talked about that in the previous session. So this is where we can come in with some scripts. At the first encounter, first checkup, give a roadmap of encounters in the coming year. I'll be giving your Harriet her first vaccines at her 2-month visit. These will be repeated at 4 and 6 months to make sure that she's fully protected. After that, she won't need vaccines again until 12 months, unless, of course, it's flu season, whatever. But what questions do you have for me? So just let people know up front what they can expect. Make the narrative personal. For someone who's new in the profession, they can say, I've never heard of these diseases. If you're fairly new, you can say, I haven't heard of them either. I haven't seen them either. But that's because I was vaccinated. The only reason I even know about them or how bad they are is because old guys like Dr. Haller talk about it at conferences. On the other hand, I can say, I've had measles, I've had mumps, I've had chickenpox. I was deathly ill for 2 weeks each time. It's really bad, and I really hope you'll get your kid vaccinated. So, and again, just letting people know that I want the same thing that you want. So, finding a way to agree. So, make use of everyday metaphors. You're right. You say, no, my child's not going to get that. You're probably right. Your child will probably never get pertussis. But on the other hand, you're probably not going to be in an accident on the way home, but you're going to put your child in the car seat, right? Because it could happen. Things happen that you can't plan, and this is one of these things that nobody plans to get sick with an infectious disease that's life-threatening. But that's where vaccines can help us. So let's give this a try. Okay. It's your birthday. There's going to be role plays now. Okay. So everyone at your table, get into groups of 3 or as close to groups of 3 as possible. Maybe a group of 4. Okay. So get a group of 3. Oh, you're perfect. You got 3 there. You got 3. Well, and you can do a 2 here. You got 3. Hey, why don't you move to that table? You can get a 3 and a 3. Okay. But anyway, get into groups of 3, and here's what we're going to do. Here's what we're going to do. I need my phone. I need my phone because I need my timer. Got my phone. How's everyone doing here? 3 and 2. Okay, you're good. All right. So what we're going to do is decide who is in your group, who is number 1, who is number 2, and who is number 3. Okay, decide that amongst yourselves. And what I want you to do is number 1. Okay, everybody. Okay, everybody, up here. Everybody, whoever's number 1, it's your birthday. Congratulations. Now, for the next minute and a half, I want you to tell the people in your group what you want for your birthday. And you can want anything. There's no limitation of expense or plausibility or morality. What happens in the Windsor room stays in the Windsor room. And the other people in your group, what they have to do is respond with some version of, no, that's a really bad idea. That'll never work. You shouldn't want that. Okay? And yeah, and you have to keep coming back. This is what I want. This is what I want. But everyone else keeps saying, oh no, that's so wrong. You can't want that. And give reasons why you can't want that. Okay? Do we have questions about that? All right, everybody, go ahead. Okay, everybody, back up here, back up here. Who was number 1 in each group? How was your birthday? Kind of sucked, didn't it? Man, what a negative group. Okay, who's number 2 in your group? Number 2? Number 2. Guess what? It's your birthday. Woohoo! Okay, now this time, same thing. You can want anything you want. The other members of your group respond with a version of, that's a great idea, but here's why it's not going to work. I really love that, but here's why it's impractical. We ready? Okay, go. All right, everybody, back up here, back up here. Number 2, who was number 2? How was your birthday? Kind of confusing, right? It's a little, I don't know what to think about that. Okay, who's number 3? Who's number 3? Number 3, guess what? It's your birthday. Yeah, okay, now, this time you tell everyone in your group what you want, and they respond with some version of, that's a great idea, and here's how we're going to make it happen. All right? Everything comes to those who wait. Okay, go ahead. Okay. All right. As Matthew McConaughey would say. Okay, so who was number 3 in each group? How was your birthday? Awesome! Okay. This shows the power of the yes and response, okay? When you get people to agree with you, find something to agree on. Now, the thing is, the yes and response with vaccine hesitancy is not, yes, you're right, vaccines will poison your child, we're not going to vaccinate your child. That's not the yes. The yes is, and I can see you love your child and you want them to be healthy. You don't want them to be hurt. That's wonderful. I want the same thing. Tell me more about what exactly you've heard. It works really, really well. So, we're going to move on now. And now COVID vaccines. So a little bit about COVID vaccines. You know, there have been concerns about the safety and side effects of COVID vaccine. One of the things, I was talking about the RSV vaccine earlier. How many of you were following the development of the RSV vaccines? Yeah, maybe a couple of us, right? But when those came out, it's like, holy crap, I got RSV vaccines. That's awesome. I didn't know anything about it, and I'm a pediatrician. But COVID vaccines, we were hearing about this day after day after day. We were down in the weeds of this in the places where generally the general public and even a lot of us in healthcare don't go. And there were so many problems with it, aside from the fact that there are all kinds of political ramifications to it. So there was all of this stuff going on that made it really difficult. So there's also, remember I talked about my iPhone. There's also the idea of early adopters versus middle adopters versus late adopters. This is my iPhone. It's an iPhone 6. It's like really old. It works just fine. Why do I have to get a new one? And when it comes to vaccines, I think a lot of people are like, well, let's see how it works. Let's see how other people do with it. So again, it's a completely rational and emotional response. I'm a little scared of it. I want to see how other people react to it. So let's see what happens. So again, COVID vaccines happened so fast. Yeah, they really did. They really did. What is your concern about that? Well, I don't know if they got everything done. Well, that's the amazing thing. They were able to get all the stuff done that normally happened before, but instead of it being one thing after another, it was like they were able to overlap them and happen kind of at the same time. I say, remember when you were in 4th grade? You did an experiment with electricity, and you had light bulbs, a couple of light bulbs in a row, and that was in series, and the electricity went through all of them. And then you had light bulbs like right next to each other, and the electricity went through all of them at the same time. Oh yeah, I remember that. Everyone remembers that. Everyone has seen that experiment when they were a kid. It's the same thing with the COVID vaccine. They were able to develop all these things by doing all the stages at pretty much the same time, but everything got done that would have gotten done otherwise. And I've had people go, oh, okay, that makes sense. Now, motivators for vaccine acceptance. This is, I think, from about 2021. I don't think it's changed much. Family is the main driver of this. Protect yourself and protect your family. Your country, America, 20%. The economy, 13%. Your community, 8%. Your friends, 6%. Wow. People like their friends. So, anyone remember this movie? 2012? So, really crappy movie about the end of the world is coming because the Mayan calendar ended. I guess it's that they ran out of rocks. I don't know. But anyway, it does happen. And who is the hero? John Cusack. John Cusack, like indie actor from Chicago, is like an action hero. Is like so cool. But anyway, so here he is trying to get on this plane. That's his ex-wife reaching for him, and he's running, and Los Angeles is falling apart behind him, and her new husband is piloting the plane. It's complicated. And they're taking off, and then they take off, and they fly away. And look, all these buildings are falling. There are thousands of people dying before our eyes. Do we care about any of them? No, we only care about the people on the plane. They're our family. And so that's why I've heard pediatricians say, well, we should say to people, you should get their child vaccinated because there may be other children in your child's class who can't get vaccinated, and that way that'll protect them. What do parents do? La, 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 I don't care. I mean, I'm sorry, but that's just the way it is. You want me to do something to my child that I have concerns about to protect some other kids, some other kid? I'm not going to do that. I only care about the people in the plane, my family. So the thing is, and it's been said many times today, a strong recommendation from a trusted health provider who provides trustworthy information on COVID-19. This is from 2021. State government, 58%. Dr. Fauci, as much as 68%. CDC, 76%. FDA, 77%. Primary health provider, almost 90%. And we look at this, primary, your child's pediatrician, 95%. Thank you. So, people really do trust us, especially if they have a relationship with us. And so if we give people a strong recommendation on this and just make it part of our everyday thing, and so today we're going to do this, we're going to do this, we're going to do this, the vast majority of people will be, okay, that makes sense. Now, interestingly, again, I thought the COVID vaccine thing was unusual in terms of vaccine acceptance. A couple of years ago at this conference, when it was virtual, Kalichi and I did a presentation on the history of vaccination. And I had kind of been living with this narrative that when polio vaccine came out in 1954, that everyone went out and got themselves and their kids vaccinated immediately. Because, people had been looking at newsreels of kids in iron lungs. Kids were going around for the March of Dimes, collecting money for 2 decades. And so I thought, well, I guess, this is unlike that. But, one of the things about COVID vaccine and COVID itself is they're so new that people have doubts about it. And yet, in 1957, it's the March of Dimes. They did a study looking at polio vaccine acceptance by February of 1958, which was 3.5 years after the vaccine was introduced. By that point, they had expected about 85% of target groups to be vaccinated, and none of them hit that target. About 1 out of 8 adults, 21 to 40 years old, was vaccinated. About 40% of teenagers, about 60% of those under 7 years old, about 75% of those 7 to 12 years old, and they were eligible for free school vaccinations, but no one hit that 85% almost 4 years out. And the question was, why are some people not getting vaccinated? And what it came down to is, what they did was they interviewed nearly 4,000 adults under 40 for 45 minutes each. Oh, can you imagine? Okay. What'd they say? Plain procrastination, never got around to it. Well, I don't think I'm susceptible to polio. Victory over polio has been achieved. And social factors. The people in my social group did not get vaccinated. And if you haven't gotten it, what would cause you to get it? A new polio outbreak, knowing someone who had it, and doctor's recommendation. Does this sound familiar? The thing is, what we've gone through with COVID vaccine is not all that different. It's expanded, it's much louder, But this has been going on for a long time. This is basic human nature. And that's one of the things that drives me crazy about this profession. I have to deal with human nature. And it can be really annoying sometimes, but that's just the way it is. People really need a lot of convincing, a lot of interaction, a lot of, hand-holding. And the more we can do that, the more it will bring people along. So I just want to tell one success story, then we'll do one other thing. So in January of 2022, which was about a year after vaccines, first came out, but there was another big rise in COVID in January of that year. I was in my office, and a couple came in, and they just had a new baby, 4-day-old baby, and they're really excited, and baby looks great. And I said, well, and so here's what we're going to do. I gave them the roadmap for going ahead. I said, the other thing that's really important is everyone in your household should be vaccinated against pertussis. And have you all had your tetanus shots within the past 10 years? Oh, yeah. Okay, so you're good. How about flu? Oh, yeah, we've had our flu shots. How about COVID? Oh, we're not getting that. I said, okay, could you tell me a little more about that? Well, I don't know. It just seemed like it happened so fast. And I talked about, it did. And I went through the thing about that I explained earlier. He goes, yeah, well, I just don't know. I don't know. I don't even know. Do you even know what's in that vaccine? I said, actually, I do. So, and he said, it's just that I'm just a little bit scared about it. I said, I hear you. It is scary. It's a scary time. And I know you want the best for your kid. But I got to tell you, a year ago, in December of 2020, when vaccines were first available, I got an email from SSM Health saying, vaccines are available for the healthcare providers. Click on this button to get to set up your time. And I started clicking on that button like I was trying to get tickets for a Beyonce concert. Honestly, I probably should have said Barbra Streisand. But anyway, he wouldn't have understood that. So he said, really? I said, yeah. And when I got that first vaccine on December 22nd, 2020, in the lobby of St. Mary's Hospital. And when I got that jab, I cried. I cried not just because I'm old enough to be in a group that could get really sick with COVID, but for almost a year, for 9 months, I've been worried that I might pass this on to one of my patients, and I just couldn't have handled that. If I got sick and then I made one of my patients sick, and I thought maybe finally I'm at a point where I won't have to worry about getting my patients sick from COVID. Well, where can I get that vaccine? I said, pull out your phone, let's find the nearest Walgreens. And he did. They went off and got vaccinated. So thank you. That was my COVID success story. So the thing is, I didn't need any science. I didn't pull out any studies. I didn't show any charts or graphs. I just told my truth and told my story, and I listened to him and what was concerning him, and it worked. So let's do one more thing. Okay, now we're going to be in groups of 2. So groups of 2, figure out a partner, and if you have 3, you can do like 2 on one side and 1 on the other. And then one of you is the healthcare provider, and the other is a vaccine hesitant parent. Now, what we're going to do, and don't worry, we're going to switch roles. We're going to switch roles. Now, the first time you do this, the vaccine hesitant parent, you've got a minute and a half to tell. You've got a minute and a half. Sorry, you got a minute and a half to tell the doctor, the healthcare provider, why you don't want to get your kid vaccinated, and the healthcare provider. Now, this time, the first time around, I want your response to be the sort of backstage thing that we would never ever say to a patient. Okay? What the matter with you? And how can you be so stupid? So let's just see what that feels like. Let's exorcise that from our system. Okay? So has everyone figured out who's number 1 and who's number 2? Okay, ready? And you got a minute and a half. Go. Okay, we're done. All right, okay. Well, that was loud. Okay, now we're going to switch roles. And this time the one who was the parent is now the provider, and the provider is now the parent. But this time, I want you to use messaging that where you're listening to understand, where you're reflecting back, where you're respecting the fear, you're recognizing the love. And let's go ahead. Got a minute and a half. Okay. And we're done. Okay, so who are the Who were the vaccine hesitant parents the first time around? Are you ever going to take your child back to that healthcare provider again? What a jerk! Wow. Okay, who were the vaccine hesitant parents the second time around? Do you think you might get your kid vaccinated or at least come back and have a conversation? Yeah. Okay, so who were the healthcare providers first time around? That was fun, wasn't it? Don't ever do it again. And who were the healthcare providers second time around? I know it's a little harder, but it feels good when you're done, especially if you can have a meeting of minds there. So again, thank you all very much. Just to repeat one of my slides, assume parents love their kids, recognize that parents have a very different knowledge base. Factual statements are generally emotional, honor and value the emotions, ask parents about the basis for fears, acknowledge parental fear is real and even healthy. Then you can share your stories, help parents recognize the appropriate target for their fear, and provide a fertile ground in which trust can grow. So thank you all very much. And that's all I got. Thank you.
Thank you, Dr. Holler, for this amazing and interactive session.
You were all wonderful.
So we hope that this session has given you a few more tools for your toolbox as you go out into your communities, building immunity in Missouri communities, talking to patients, talking to parents about how to address vaccine hesitancy and how to build vaccine confidence. Dr. Holler is one of the best, and we're all really, really lucky to have gotten to learn from him today with this session. So with that, I will open it up for a short, because we are just about at time, and I know everybody's getting hungry for dinner, and we hope a lot of you will join us at our networking dinners. Any questions for Dr. Holler? I'm going to go to the closest first, and then we'll come around.
Hi, so I'm from a rural community, and we have one provider that, especially whenever it comes to like flu and COVID, he's a pediatrician. He's like, it's not a big deal. You don't really need to get that. So then whenever they come in for WIC appointments or other, we're having to like combat that.
Oh, I'm sorry to hear that.
So what would be some tips maybe to help build that relationship there?
I mean, again, it's sort of a, I don't want you to say he's a jerk, but I do want to say, well, the thing is, this has been a learning curve for all of us. What we have found is that when we give these vaccines, people who get them tend to have have less chance of ending up in the hospital, getting really sick, and so we really strongly recommend that vaccine. So again, I wouldn't necessarily say, this person's a jerk, although he is. But more, that's the backstage thing. Just say, I understand that that's what he said. Our experience is this. And again, the science is really important, but I generally tend to go with experience. And this is just sort of a gut thing. Our experience is this: when people get this vaccine, I mean, one thing I've said is, I've never, when it comes to like flu vaccine or COVID vaccine, I've seen plenty of people in the hospital because they had the flu or COVID, but I've never seen anyone end up in the hospital because they got the flu vaccine or the COVID vaccine. And that's been a very powerful statement that a lot of people have said. So maybe that, yeah. One over here too, yeah.
And I think that piggybacks off what we heard from this Lambert and Lana presenting from the state, which is that we need to be talking about immunizations at every step of the patient encounter. The front desk people need to be talking about it. The triage nurses need to be talking about it. The security guards need to be talking about it. So that when patients do receive a negative message from a trusted healthcare provider, they're also being counteracted with positive messaging from all of the other staff in that environment.
Right, yeah, a very good point. So I think if you start that right at the beginning, they may just kind of go, oh, okay. So, yeah.
So how do you address vaccine hesitancy amongst the healthcare workers?
It's been tough. I mean, I at SSM, I mean, we had some people, it was a requirement, and some people decided to quit because they wouldn't get COVID vaccine. And and some have quit because they wouldn't get flu vaccine. And so, I mean, I think that I'm not speaking for SSM, but I do think that we have to follow what the science says, and if people are not going to do that, then we have to have a conversation with them about whether this is a place where you want to work or not. I mean, I think that's really what we need to do. Thank you, thank you. All right, I think that's probably it, because we got to get to dinner, right? Okay.
Yep. I think that will wrap it up. Nicole Cope has one or two more final announcements, and then we will
Okay.
turn you loose on
Here
Columbia
we go.
for dinner.
And if anyone wants to ask any more about this stuff, I'll be around all day tomorrow, too. Thank you.